First at 6, the Charlotte-Mecklenburg Police Department is losing a key player who serves a critical role in keeping officers' mental health in check. Good evening. Thanks for joining us. I'm Morgan Francis. We have Emma Withrow here. The department, with more than 1,500 officers, is losing their only psychologist this Friday. So, Emma, you sat down exclusively with a former CMPD officer who worked alongside the psychologist and quit a week ago herself. What's going on here?
So, Morgan, I've previously reported on retired police officers with PTSD who were struggling after leaving the department because of the high costs of mental health treatment. But now the lack of resources is directly impacting current officers who no longer have a professional to turn to in their darkest moments. The Charlotte-Mecklenburg Police Department's chief, Johnny Jennings, says employee wellness is a pillar of his top core values. He details this claim in length on CMPD's website, referencing his efforts in supporting better mental and physical health for all employees. Though Shannon Finnis, who worked for CMPD for 10 years and quit last week, begs to differ.
I hate to say it, but it's a box check. Mental health and wellness is a box check.
Finnis, at a time, played an instrumental role in carving out a new culture at CMPD, focused on officers' mental health and well-being.
I got sent to the FBI National Training for Resilience,
which is a 3-day program to equip first responders with the ability to change the stigma surrounding mental health issues within their organization.
Pitched it to the chief at the time about bringing that to the department so we could, help other officers, because I saw the need.
The program, titled Resiliency Training, launched within CMPD in September of 2020, and Finnis led the charge.
It was a 2-day class. It was small. We never had more than 15, but just first getting the education around, the stressors and trauma of the job, what that kind of looks like in symptoms and longevity-wise.
Finnis said despite the class having significant success among officers, measured in the survey responses they gave, upper management never required officers to attend.
At one point, we had been teaching the class for a while. I had to put in the email at the bottom, this class is not mandatory. If you don't want to come, you don't have to come. And our numbers dropped and people just didn't show up.
Why did you have to put that in the bottom?
That's what I was told to do.
In 2022, Finnis and CMPD's only psychologist, Dr. Nikki Vasilis, were told to stop holding the resiliency training with no explanation. Finnis worked closely with Dr. Vasilis and witnessed firsthand her intense workload aside from the resiliency classes.
She overextended herself for sure. I think maybe 80 hours a week, sometimes taking calls in the middle of the night, but she worked really, really hard to change how we were doing things.
Finnis said Dr. Vasilis quickly gained the trust of many officers and started opening up the dialogue about mental health within the department.
If an officer didn't want to meet at the office because they were afraid somebody would see him, she'd go meet him wherever, coffee, in their car, anywhere. So she was willing to meet people where they were at, and I think that's how you make change.
But after a year and a half, without the help of any other clinicians, Dr. Vasilis resigned. According to a University of Washington Psychiatry and Behavioral Sciences study, the average psychologist should take on between 50 and 75 patients. Dr. Vasilis was responsible for the mental health needs of nearly 2,000 sworn officers.
There was 1 week she had close to 300 calls from employees, so clearly she's not enough. She needs to have support.
When Chief Jennings announced Dr. Vasilis' departure, he reminded officers of the additional resources that are there. In an internal email we obtained, he listed peer support, the employee assistance program, and the chaplain. Now, Dr. Vasilis is starting a new career at the York County Sheriff's Office. According to Michelle Hummel, the negative mentality surrounding mental health and wellness is nothing new for CMPD.
Who was not supporting the focus on mental health?
It would be, that executive staff level, that higher level, that's probably the furthest removed. So maybe not seeing the impacts that it's having on officers and sergeants down at the lower level.
Hummel retired from CMPD in 2019 after 30 years of wearing a uniform. She said despite CMPD's resources, it takes involvement from the top to actually change the culture.
The key is if the higher ups will get trained and your sergeants that are supervising your folks, like there needs to be that serious buy-in and understanding at the top level, and then you need your lieutenants and your sergeants and your captains to really be able to hone in on the things to look for.
CMPD is currently down around 500 officers, though that number's never been made explicitly clear by the department. They're currently on the lookout for a therapist to fill Dr. Vasilis' position.
So I reached out to CMPD and requested an interview with Chief Johnny Jennings, but once again was denied. CMPD also refused to answer questions surrounding Dr. Vasilis' employment status and instead told us to file a public records request. That request has still not been fulfilled. We also did reach out to the city manager, Marcus Jones, for an interview and was told once again he was unavailable.